All right. So it's 5 p.m., so I guess we get started. Welcome everyone to this webinar on Bayer G4A and partnership opportunities with Bayer G4A. My name is Christina Habeck and I'm part of the Bayer G4A team and I will guide you through this webinar today. So let's first have a look at the plan so everyone knows what's ahead today. We're going to start with a bit of a broader angle, looking at the takeaways for digital health innovators that we see from the COVID-19 crisis. We're doing so to provide you with a bit more of a background, why we chose certain challenge areas this year, and what is important for us when we're looking into partners. Afterwards, we're going into depth about the partnership opportunities that we're offering at Bayer G4A. And we're at the end, the most important thing, we're going to have a Q&A with the Bayer G4A team. So if you have any questions while I'm going through these slides, just put them into the chat and we're going to answer them afterwards in our G4A, in our Q&A session. So let's get started with the takeaways for digital health innovators that we saw. What we observed is that the pandemic clearly accelerated digital health through a push and pull dynamic. We saw on the one side a push dynamic because COVID-19 really spurred a momentum for digital health. We saw an increased adoption of digital health and a mindset shift among health consumers. But we also saw a pull side of things because COVID-19 really revealed and increased the need for digital health. We saw once again that social determinants are still affecting health status. We saw the health economics challenge escalate. And once again, COVID-19 made clear for us that we really need integrated care and that it's super important. And besides these general factors, we also observed for 4 concrete disease areas an increased need for digital health solutions. So let's get first into the push side of things. There's, of course, first the increased adoption of digital health solutions. So both when we look at telehealth and virtual care, people use more technologies. 44% of people use new devices or apps to help manage conditions remotely. The same holds true for the use of health mobile apps. For instance, in the UK, we saw a 25% rise in digital health app downloads. And what is also super interesting to note is that next to the increased use of digital health technologies, consumers or health consumers are also more likely to actually track their healthcare data digitally. So we can see that actually proportion of people doing so increased with 16 percentage points. Now, the question is valid. Well, this is only during the pandemic. Of course, people use more digital health tools. Does it also hold after the pandemic? And we believe that there is good reason to say that this will be the case, that digital health is here to stay. There are studies saying that 25% of users plan to continue using video appointments and digital tools for their healthcare appointments. And there are also findings that say that current use of technologies is positively correlated with future use of technologies, and that the current adoption of digital health tools actually just increase the appetite for future health technology. Next to the increased adoption, we also saw that COVID clearly shaped a new generation of healthcare consumers. We saw that patients became more empowered. They consider it important to take their health in their own hand. And that goes even so far that they're also more willing to engage in do-it-yourself care. 85% of people are very or somewhat likely to engage in DIY care. We see that people are more invested into their health as a result of the pandemic, both financially, so 20% of people have increased their healthcare coverage, but also mentally. We see that many people are concerned about their health and seek to improve it. And that also translates to health literacy and how far consumers are actually incorporating health concerns in their day-to-day decision-making. So 65% of people are actually more likely to do so as a result of the pandemic. And what we can also see is that the trust in digital healthcare increased as a result of COVID-19, more consumers are willing to share their personal data, and also the trust in virtual doctors has accelerated. So these all are factors that are favoring the acceleration of digital health, and that led to the momentum for digital health that we could see in the market. This was the push side of things, and now looking at the pull side of things, we also saw clearly that COVID-19 revealed a need for digital health. The pandemic clearly showed us what are the pain points in our healthcare systems. We saw that social determinants are determining people's health status. In the US, Black people were twice as likely to die due to COVID-19 compared to white people. And the effect of social determinants, it's not only a US only problem. Also in Europe and Germany, the mortality was 50 to 70% higher in deprived areas. We also saw the health economics challenge escalate during the pandemic. Actually, the healthcare system costs during the crisis, but also after, are expected to kind of explode due to deferred or canceled treatment, to long-term and unknown health impacts. So there really is a need for increased productivity. And we also saw a need for integrated care revealed during the digital health, during the COVID-19 crisis. We saw that cooperation of healthcare providers is crucial, for instance, of nursing homes and hospitals. We saw that physical and mental health has to be seen as a whole and not in silos. And we also saw the importance of usable real-time data to make informed healthcare decisions. So the pandemic really showed us what we still have to change about our healthcare systems. And we as Bayer G4A believe that digital health can play a vital role in closing these gaps and actually ensuring health equity, sustainability, and access for all. And next to this general increasing need for digital health solutions, we saw a particular increase in 4 disease areas, which are cardiovascular diseases, oncology, women's health, and mental health. For cardiovascular, it is especially important to note that many people actually postponed or neglected their self-care and prevention of severe diseases during the pandemic. And that is why we're expecting higher rates of these diseases after the crisis. And next to these longer term effects, we can also see already now that severe diseases are increasing because COVID survivors have often developed comorbidities that actually require treatment for severe conditions. One of the most pressing ones is diabetes. We saw that 14.4% of people hospitalized with severe COVID-19 actually developed diabetes and now need new treatment options, where, of course, digital health can play a role in closing this need. A similar picture can be seen for oncology, where we actually had a lot of delayed diagnoses of cancer cases. So in developed countries, we saw decreasing incidence of cancer, and that is unfortunately not because there was less cancer, it is because less cancer was diagnosed. And we expect the diagnoses of cancer cases to increase again after the pandemic, and that is also kind of mirrored in the expectation that the spending for oncology is going to grow enormously after the pandemic. And what the result of this is that we're going to have more cancer cases at a later stage, which need even more complex and specific treatment options, where we, of course, also want to see digital health taking over an important role. And then there's, of course, mental health. It's no secret that the pandemic led to increasing mental health issues. 4 in 10 adults in the US have reported symptoms of anxiety or depression during the pandemic. And what is most concerning about this is that it is particularly young people and racial minorities and Black population in the US that is suffering from suicidality. And these are the groups that are traditionally having low access to healthcare. So we really would need to provide solutions here to provide them with the proper care for their mental health issues. And we wanted to health to play a role there as well. And then the 4th component that we saw is women's health, which hasn't been discussed widely in public, but has been an enormous issue during the pandemic. Women have been more likely to go without healthcare than men, and this development is expected to continue after the pandemic because the female job loss rate during the crisis was much higher than the male job loss rate. and often healthcare insurances are tied to employment. So we can actually also expect women to be at risk of having no healthcare also after the crisis, not only during the crisis. So why am I telling you all this, and what does it have to do with Bayer G4A? What we are really focusing on this year is that we want to build partnerships that build upon the momentum for digital health that I've just outlined, but that also address the needs that were revealed during the pandemic. And in this frame, we're looking for different kind of partnerships, ranging from commercial partnerships through co-creation, M&A, late-stage investments, but also early-stage acceleration and investments. To give you a clearer picture of what our offer is for potential partners, let's have a look at this slide. What we're offering is 2 tracks. We're offering the growth track and the advanced track. The growth track is more of our acceleration track, which is suitable for seed to Series A startups. What we require companies in this track is that they have a minimal viable product with ongoing validation or published findings. And what we offer in return is a 20 to 100K convertible loan investment, potentially co-working spaces. To be honest, this is of course kind of dependent on the pandemic situation this year. But then also most important, we're offering mentorship by Bayer executives and valuable coaching by Bayer experts and also external industry experts. And then the advanced track, on the other hand, is more of our commercial partnership program. What we're for this track is really for companies that are Series A or above and that have a published validation and clinical studies. What we also require for this track is that you're already on the market and that you have traction with users or customers or even revenue. And what we're offering for this track is kind of dependent on each company. We're offering different commercial partnership formats that are negotiated individually. So potential forms of collaboration would be commercial deals, co-creation, joint venture, and investments. And of course, a big benefit of this track is as well that you're becoming part of the Bayer G4A network and our collaborations. Now let's look at what solutions are we actually looking for this year. We're looking for solutions in the field of cardiovascular diseases, women's health, mental health, oncology, and radiology. So you can clearly see that we're kind of mirroring the need from the pandemic that we outlined earlier in our challenge areas. For cardiovascular focus area, we have 3 challenge areas. We have the lifestyle behavior challenge, and here we're looking for behavior change solutions that reduce the progression of CV diseases. And we're looking for behavior change solutions that are addressing risk factors of CV diseases, like, for instance, sleep health. Then the second challenge would be patient monitoring and digital biomarkers. What we're looking for here are solutions to monitor patients, to monitor disease progression and treatment effectiveness for CV diseases. And we're also looking for solutions that are developing new biomarkers to actually identify risk of CV diseases or acute events. And then we have the social support challenge, where we're looking for platforms or solutions that allow patients at risk of CV or who actually have cardiovascular or cardiometabolic diseases to engage with each other and to gain social support. Then we have the women's health challenges. We have 2 there. The first one is the screening and diagnosis and improvement of bone health. What we're looking for there is solutions to assess the risk for osteoporosis and solutions that also help in case of osteoporosis. What we're also looking for there are solutions that prevent bone deterioration and improve bone health. And then we have screening and diagnosis of PCOS and endometriosis. There are digital health that we're looking for digital health solutions that help with early screening and diagnosis of these conditions. We also have a mental health challenge where we're looking for solutions that help improve and manage mental health and wellness. And then we have oncology, where we're having 2 challenges. The first one is about digital solutions that help to calculate performance status measurements and quality of life for cancer patients. And what we're looking for here in concretely is solutions that are also able to support valid measures of, for instance, daily activity, breathing patterns, and body temperature. So all these indications that are crucial for cancer patients. And we have as a second challenge the oncology digital biomarkers, where we're looking for solutions that identify patients through digital biomarkers for specific therapies. And the cancer types that we're focusing on here is non-small cell lung cancer, breast cancer, prostate cancer, colorectal cancer, and also gastrointestinal stromal tumors. And as a last but not least, we have radiology, where we're looking for AI for early detection, screening, and identification of abdominal aortic aneurysms. So these are the challenges where we're looking for solutions. And if this sounds appealing to you, we would be very happy to receive your application for our G4A partnership programs this year. If you want to apply to our partnership programs, please be aware that the deadline for applications is the June 20th. And if you want to apply, you just have to go through 3 steps. It's super easy. You first have to find out which track is suitable for your company. So if you're more of an early stage company, it's probably the growth track. If you're more of a mature company, it's probably the advanced track. But have a look at our website as well to get more information on that. And as a second step, you should look at the challenges that I've just presented. They're also featured on our website, and become aware if you have a solution to one of these challenges. If your solution is addressing multiple of the challenges that we're posing, that is even better. You can also apply to multiple challenges. And as a third step, just go to our website, hit the apply button, and then complete the online form on there, and it will just take you approximately 30 minutes to fill in this form. If you now have any questions concerning our applications, you can just stay in this webinar and ask Sophie Park and Bharat Rahupali in our live Q&A that we're just going to have, or you contact us on social media, on our website, or via mail. Yeah, with that being said, I would like to hand over to Sophie and Bharat for the Q&A.
Thanks, Christina.
Thanks, Christina. Hi, everybody. So thank you so much. And this is really your time. I know we have a lot of time left, but this was also done on purpose so that we can answer any questions you may have about the challenges, what stages of applications, etc. So Bharat and I are here, and we can go through the first one. I think it's down below. Bharat, maybe you want to take this. Can I apply to more than one challenge?
Yeah, thanks, Sophie. Yeah, absolutely. We are looking for multifaceted solutions or integrated solutions that can hopefully solve various challenges which we have listed and which Christina just presented. As part of the application process, you will be able to choose the various challenges which your solution is already addressing when you submit your application.
What stages of solutions are we looking for, Bharat?
Yeah, sure. So as Christina mentioned earlier, we have growth track and advanced track. So in our growth track program, we are looking for early stage companies with an MVP, and this usually is in the range from bootstrap to Series A. And with these solutions usually have an ongoing validation or have some published findings. And for our advanced track program, we're looking for more mature companies which already have a product in the market and have validated product and revenues and customers.
And I guess the next question, what type of business models are we looking for? This really depends on what kind of solution you have and how well the solution fits to our challenge. But really, we're very flexible on the different kinds of business models, regardless whether it's, direct to consumer, B2B, B2B2C. We're super flexible that way. We don't particularly, we're not super nitty gritty and looking at only one kind of business model. So we're very flexible on that. But I think the most important aspect is to look at the challenges and making sure that the solution actually refers to, the very specific challenges that we need this year, which can be found online.
So
how can I apply?
Yeah, so I can take this one. So we can share a link. Maybe I can also add it in the chat, through which you can access our application portal, and you create an application and fill out our form. There's also a CDA, which is part of the application process, so that we are covered, and you can also share any kind of confidential information. And then we go through the due diligence process, and you can also find the dates on the portal on the various deadlines and milestones of when the next steps would be.
And you also currently have this screen up here. Maybe you guys can take a screenshot of it. But if you go on our website on g4a.health, all of the information that we're sharing is also there. And we do have an FAQ page as well. So Bharat, what's the selection process?
So the selection process is essentially, so we have 4 review processes, and once you submit your application, and the deadline is June 20th, by the way, once you submit your application, we'll then take them through the various review stages, and then the application process, the application, once it reaches the semi-final stage, we will then invite you for one-on-ones with our product owners, and then we can talk about next steps for a potential partnership for advanced companies and for growth companies for next steps from our various offerings.
Right. So just make sure to note that, our deadline for applications is June 20th, and we do have rolling reviews. And so, it's better to submit your applications early because during the last couple of weeks, then we'll have a lot flowing in. So just FYI on that. And as Bharat mentioned, normally we do announce kind of like our finalists, and during that time, it'll probably be around early August, and we'll invite everyone for further conversations with teams and project teams as well for those finalists. Is the growth track open for pre-funding startups or pre-funded startups? Short answer is yes. However, in all transparency, we have not taken any pre-funded startups through our growth tracks in the past. However, we are very open to it. We do ask that there at least be some kind of a promising like validation or a study that's happening. In addition to that, we also look at kind of early traction, potential partners that you may be talking to, etc. So yeah, in short, we do. But in all transparency, we have yet to have taken a company in, but maybe yours could be one this year. So you should still apply.
What type of solutions are you looking for in the radiology challenge? I could take this. So in the radiology challenge, what we're looking for is an algorithm for identification of patients with abdominal aortic aneurysm. The application should support the radiologist to report by screening for AA and identifying these patients early for better patient management and reducing complications. It's essentially for supporting early diagnosis of the disease and on abdominal contrast CT scans. You can also find more information of this on our website.
can a company that has already been in the G4A program previously apply for the growth track? Yeah, why not? Actually, we do always encourage that because, sometimes we do get a lot of companies that may be a little bit too early for us. But we've recently had conversations with companies that applied 2 years ago and really didn't make it through the finalists, but we've contacted them again because we are always very curious about the growth of the company. And so absolutely, you should still definitely apply. And we really do encourage that. Is there a rubric for each challenge? So I'm assuming that's going to be like the due diligence rubric. Maybe we can just let them know what we sort of look at, Bharat, from a high level overview. So our due diligence process is pretty thorough. And you'll also see that when you open up our application phase. And Bharat, please chime in if I miss something. We do understand that, especially for early stage companies, we don't look as deep into, profits and revenue and things like that. We would like to see what kind of a business model you guys have and what sort of early traction that early companies have. But in terms of a rubric on how we sort of grade or scale some of these companies throughout our due diligence process is we look at the teams that are there, the executive team, whether these are board members, direct team members. If it's an early company, then, who are the people kind of running the show. In addition to that, we look at obviously the strategic fit to the challenges that we have. Part of the reason, and it kind of goes for both Bayer and the company, we want to make sure that whatever company we do bring in has a good fit to the challenge. So that's high on the priority list for us. Third, we kind of look at traction. And I think traction sort of is an all-encompassing word that could mean a variety of things, whether that's the engagement rate, the customers that you have. Some companies who apply do already have profit. They're very successful already in the industry. Some companies have, private-public partnerships. We look at that. Some companies, early stage companies, may have won awards. We also look at that as well, in addition to, validation, which is also a part of traction. And a little bit on the fourth side, which would be kind of like the validation, whether that's, for a later stage company, we do really look at the clinical studies they have, if it's a clinical product, or, some sort of a validation that there are positive health outcomes with some of these companies. And so we look at it from four sort of very kind of overarching categories. And maybe Bharat can add if I've missed any.
Yeah, thanks, Sophie. Yeah, in addition, I think just another point that we also look at is, I don't know if you mentioned it, but also differentiation. So in the sense, we look at how your product compares with already established solutions and the differentiation with it. And of course, the business model in terms of how it can be implemented or scaled. And do we think there's some significant hurdles exist with the existing model?
Yeah. Because we do have to raise eyebrows when we see companies and they say there are no other competitors, which quite frankly is usually unlikely. What are the goals of the joint venture with Bayer? So the goal of some of the joint ventures would be developing, it's more of co-creation. So we are looking for particular companies that are willing to co-create or go into a joint venture with Bayer. And what the goal of this is to really create an integrated product or a solution that can do multiple things within our different sort of challenge areas. So I would say that's kind of like the biggest goal of what these joint ventures are meant to be, or these co-creation opportunities are meant to be. Do I own the intellectual rights to software or technology once developed? So yes and no. The IP always belongs to startups, your company, your solution, your intellectual property. However, these do change once we kind of go into more of a joint venture and co-creation. Then, usually we'll negotiate certain types of rights, IP rights. And so this is really on a case-by-case basis. But when you do apply, just as like a partner, then yes, for sure, you do own the IP. We prefer that. But once we start getting into the details, more for like the advanced track companies where we jointly develop something together, then that is when we will have further conversations on a case-by-case basis on who owns what. In the oncology track, would brain tumors and biomarkers for neuro-oncology be of interest? Would you like to take that, Bharat?
Yeah, sure.
Currently, okay. Yeah, go ahead, sorry.
Yeah, so currently, in terms of the area, we are looking at lung cancer, breast cancer, prostate cancer, colorectal cancer, gastrointestinal stromal tumors. So these are the focus areas, but in terms of our challenge, but we are still open to looking at companies which are solving healthcare challenges in the neuro space. If it's an interesting company, and I'm sure oncology, the therapeutic area, would be happy to also look into a potential partnership in this area. Anything else to add, Sophie?
Yeah, no, I think you said it correctly. I mean, yeah, so neuro-oncology is a little bit, it's a little bit out of scope for us, but we are still interested if, because we're interested in looking at kind of like digital biomarkers for like pathology and imaging as well. And I know that there could be some interesting overlap there. We're also looking at companies who may have this sort of product in the pipeline or on their milestone timeline. Then we're also interested. The technology could be a little bit early. You don't necessarily need to have it. But I would say, yeah, a little bit out of scope, but still would be interesting to see what you guys have.
Does the company have to be located in a certain region? I can take this. So there's no certain specific region. We are open globally. We are accepting companies all over the globe. But in terms of where we're looking for solutions that need to scale, usually for the most part, it's primarily US and the EU. But you can also see for our specific challenges where we are looking for in terms of scalability. But in terms of location, we don't have any specifics.
Is the radiology challenge open for AI detecting cardiovascular diseases? Actually, yeah, why not? Short answer, yeah, why not? We've never really thought about it that way, but I think this kind of goes back to the question of, can you select multiple challenges? And I think absolutely. So feel free to apply. Yeah. And I think that's it, unless there are any more questions. Oh, there we go. Okay. Oh. Are IP rights post NJV agreements for each specific solution? Huh? Rights post. Oh, so yeah, again, on a case-by-case basis. So for example, if normally most of our joint ventures and co-creation will require both our side and your company to develop new product together, usually. And again, this is case by case, but normally these agreements will be made before we develop anything together. I hope that kind of answers your question. Is the growth track open for startups which are not strictly in the checklist but provide horizontal applications impacting the full range of R&D? You know, short answer would be yes. So, you know, G4A, so we do have challenges and we are looking for solutions that fit to our challenges. So the likelihood that if you don't fit to any of our challenges, you won't be one of our finalists. However, that does not mean that we don't, if we find very interesting companies, then we do forward them to our sort of internal, you know, R&D teams. So just for you guys to know, Bayer G4A sits on the commercial side of pharma. However, we do work closely with all of the functions within our pharmaceuticals division. And so, yeah, if you have a really interesting company, I would still say, you know, you should apply because again, our application process is also kind of a foot in the door. And so usually when we get some of these requests from R&D or even, you know, pharmacovigilance, various different functions within our organization, the first place we stop is to look at our application platform to see what kind of companies we do have that you know, could be interesting for them. So feel free to apply.
Yeah, and also to add, in addition, in the future, if there's a challenge that fits your solution, we actually go through our previous applicants to see if there is a fit within our previous alumni. So you would also be receiving that invite or information already directly from us if you're already part of the program through the application.
Mm-hmm. What are the opportunities in the G4A program for companies to learn more about Bayer's marketing interests? More brand marketing, I hope that's what it means. So maybe I can just go through on what we sort of offer. I think the best kind of opportunity here for companies to learn more about what our marketing teams want to offer would be to go through kind of our growth track program, because with the growth track program, we do have various stakeholders across our entire pharmaceutical division. And, you know, you get an opportunity to really kind of look behind kind of the closed doors on how pharma operates and also, you know, what sort of key, you know, findings we're looking for. And this also includes marketing as well. But I hope that was the question about Bayer's marketing interests. I guess pharma in general loves marketing in general, but I would say, you know, the growth track is probably the best option for that, because for the advanced companies, you know, we're really looking to offer more commercial opportunities. And so these are actually, you know, could be in the form of, co-creation, joint ventures, even MSAs. You know, we've had a company in the past who signed a master services agreement. So really these forms of commercial partnerships are very different. So, you know, I've seen a lot of different things happen, but for the advanced track, you know, you would need a product that's like a very like high fit to what these teams are looking for. However, for the growth track, it gives a lot of startups an opportunity to speak with a variety of people throughout the entire value chain of pharma to really understand, you know, why we market the things that we do, and, you know, understanding really kind of the backgrounds and nitty-gritty information on the entire value chain. So I hope that that answer helps. What are the examples of positive business outcomes from the advanced track alumni from the past years? Yeah, so there's actually several. We've published studies with actually a growth track company several years ago called Expert on Ventastep studies with their R&D team. They were able to prove that, you know, through digital solutions, there could be a potential to track kind of like the 6-minute walk test for cardiovascular diseases. We also had recently a company that signed a master services agreement with the radiology teams to actually build algorithms for a variety of radiology products. That's another positive business outcome there. In addition to that, our cardiovascular teams are working with the company for behavior change, and they were also able to prove through this pilot that old people, in fact, senior citizens above the age of 60 can successfully use behavior change platforms and kind of really use the cognitive behavioral therapy to really switch out their behaviors. And these are also patients with CAD. And so that was also another positive outcome through some of our partnerships. And we have a couple more, but if you get onto our website, you can also see some of the companies in our advanced track that has done, quite a few things. And it really ranges, right? And I think this kind of goes back to the marketing question too, because, we've done, research pilots with some of our advanced track companies, with our women's health teams. Yeah, so it really varies. Would mobile-based solutions deriving biomarkers in the mental health space be a fit for the mental health challenge? Absolutely. Please apply. Highly relevant. Next question. Yes, very relevant. Yeah. Absolutely. Maybe these are all the questions that there are, which is great. Oh, there we go. Oh, hi, Dorothy. Would Bayer consider applications in women's health challenge also apply to animal fertility issues? So unfortunately, no, we only focus on, human health. So that would be a bit out of scope for us. Are there any more questions? We have 20 minutes. Or we could end early. I think that's it. Yeah, so, there's another one. Okay, let's see. An interest in lung-related. Girish, I hope I'm saying that right, your name right. It's a little bit out of scope for us because I know for radiology, we're actually looking more on like the pathology side of things. But we'd still be interested to see what you guys have. And so I would still encourage you to apply. Because again, this kind of goes back to, there's a variety of places where we get requests for companies. And I know COPD, if that's something your company does, COPD is another aspect of Bayer's kind of portfolio, and that could be interesting for us as well. So I'd encourage you to apply. Can companies not considered startups? Oh, absolutely. Yeah, we try really hard not to use the term startups, Lisa, because we've gotten this all the time. So yes, absolutely. SME is totally fine. The majority of companies in the digital health space that we get for the advanced track, they have like 100 employees, and so they're really not a startup at all. So absolutely, please do. We've also had a payer apply in the past. Not going to tell you who they are, but fun fact. Would solutions targeting the African market be considered? Yeah, absolutely. The African market is something that, Bayer is also targeting as well. I know that you don't see it within the challenges, but this is also one of those challenge areas where we do get a lot of requests internally from different colleagues who are working within the African countries. And so, yes, feel free to apply if you have a really interesting solution, especially in women's health. If it's in women's health, then would be very interested to see what you guys have. What is the biggest benefit of participating in a joint venture with Bayer? Is it a joint go-to-market, validation, something or other benefit? All of the above. All of the above. And really, it is a case-by-case basis. But I mean, we have also considered in the past, going through validation studies. In addition to the go-to-market is like an obvious thing for distribution, et cetera, because we do have a very wide reach. But validation is also something that we do highly consider. If that's not something that the other company has, then we can also try to run that through from our side. So really, all of the above. We take joint ventures very seriously, and so especially when it comes to co-creation with digital health companies. I mean, we're very thorough, and it's really, it's all of the above, as you mentioned, and based on the needs of whatever that company is. And if we find that the solution is a very good fit.
Last question.
I think this might have been the last question.
Okay.
Cool. Well, thank you so much for joining. And, if any questions come up in the meantime, then, feel free to email us at info.g4a@bayer.com. We do check our email every day. That's what we do. And, we do have an FAQ page, and all the challenges that, Christina mentioned earlier today can be found on g4a.health. So, keep connected with us, and we look forward to receiving your applications. Thanks, everyone.
Thanks, everyone.